All right, well, an app is aiming to calm nerves for friends and family when their loved ones are in surgery in this week's Startup Spotlight. Ease is a messaging application that gives hospital staff the ability to send secure texts, photos, and videos with real-time updates from inside the operating room. And so far, the app is used in over 60 American hospitals. Joining us now is CEO of Ease, Patrick De La Roza. And Patrick, you say these messages are HIPAA compliant, but how does the actual app work? This is a nurse that's using Ease to give families outside of the OR real-time updates.
Yeah, so what we did is we wanted to create a platform and a process that was simple for nurses to use, but also very secure. So what we've done is whenever you go to a hospital, you automatically get a medical bracelet that's put on your wrist, and it has a barcode on it that is associated uniquely to you. And so what we do is we tie our system to that barcode so that wherever there's a nurse and wherever that patient is in the hospital, you can easily scan their wrist and fire off a message to that family.
And hospitals are the ones paying for this to be installed in their systems, right? So it's free to the end user here to get those updates. But one of the questions that I had when we were looking into Ease was what kind of updates are necessary and how much does it add to the already stressful environment I imagine is in the operating room, and how do they decide which updates to give?
So that's what's great about what we do is traditionally, if you think about a waiting room, it's really a room that hasn't changed in 100 years. And so you sit there with a lot of other scared and anxious families, and you just want any sort of information. So what we've now given the hospitals is the ability to securely communicate throughout the process. So a great example would be a surgery. Let's say God forbid, your wife or your husband was having surgery and a long 8-hour cardiac procedure. Now they can give you a play-by-play of what's happening throughout the procedure. So we'll send updates anywhere from when the patient's under anesthesia so that they know that patient's safely off to sleep, to actually sending you pictures from within the OR so that you can see your loved one. We've actually had hospitals that have sent videos at the end of the surgeon letting you know that the case is complete and I'll be out to see you shortly. So it's really about giving these snapshot pieces of information along the way so that you're not sitting left in the dark.
Hi, Patrick. Brian Chung here. So I think something really critical that Zach mentioned when we first started off this segment was that this is also HIPAA compliant. So how did you kind of work with regulators to make sure that the right people are getting the information, getting these updates as they're happening, and that the patient that's undergoing the procedure has consented to this type of information kind of taking place between the OR and the end users?
Yeah, so security is at the heart of everything that we do. And so that starts with how we architected the platform and how we built our infrastructure to be able to securely communicate. But it also comes back to that process I talked about earlier, which is creating a simple way to make sure that you have the right patient every time. So the patient actually is the one that when they register, they will choose the recipients of the updates, and they will actually sign a paper consent allowing the hospital to do this. And then when you tack that on to our secure process, which attaches Ease to that bracelet, then the nurse basically has to grab their medical bracelet, scan it in order to fire a message off to those families. And so what you've done is you've basically allowed the patient to dictate who gets the updates, give the hospital permission, and then our secure workflow enables it to happen in a way that the right patient is you're sending the right updates on the right patient every time.
Now, I'm curious here. When it seems like patients and their families would be really wanting to have this information handy, but I would almost think that it's more on the hospitals or the doctor's side where they're the ones who are adopting this technology. How are you finding that it's getting used right now, and are a lot of people willing to use this technology?
So it's like with any new innovation, at the heart of what hospitals do is patient care. And so whenever you introduce a new technology or a new process, it can be a little bit daunting, or it can cause, a little bit of anxiety for the hospitals because now they have to change the processes that they've had. But fortunately enough for us, the benefits of Ease are so great. The families love it. We've actually been able to prove that we can increase patient satisfaction scores when you communicate on a patient's surgery. And so when hospitals understand those sort of benefits, they're much quicker to embrace this type of technology. And then add to that the fact that we've created a workflow, that is simple for the nurses to use. We wanted, it was probably at the heart of what we did when we created this, is we wanted Ease to be something that the nurses wanted to do, not had to do. And so by making it a simple and easy thing to do, then they're able to do that in their workflow repeatedly and throughout the entire hospital experience.
All right. Very interesting idea for a lot of families out there who have to deal with this, but fascinating stuff from Ease. Patrick De La Rosa, thank you so much for taking the time. Appreciate it.